Some troubling numbers out today show the toll that substance abuse has on families. There's a new survey by KFF, formerly the Kaiser Family Foundation, found that 3 in 10 adults in the U.S. have been addicted to opioids or are impacted by a family member with an opioid addiction.
And here in Denver, the city is on track to see a record number of overdoses this year. So far, there have been 187 fatal fentanyl overdoses, likely to surpass last year's total of 244. And that growing number of cases is putting pressure on our hospitals.
Jessica Porter's in the studio tonight to share how Denver Health is adapting to this public health crisis.
Yeah, and they are reacting quickly to this crisis by first expanding options for help and changing how it uses medication for treatment. And they are seeing patients from all backgrounds and walks of life who need help.
Fentanyl is just a different opioid when it comes to addiction, and we have to treat it differently.
In the first 4 months of this year, there was a fentanyl death in Denver every 24 hours and an overdose every 15 hours. Scott Simpson, the medical director for psychiatric emergency services at Denver Health, tells me about half of their patients are struggling with both fentanyl and methamphetamine use.
So we see people who are coming in with more severe addiction. They're having a harder time getting control of their use. They're having more severe behavioral manifestations, meaning they're having worse mood symptoms. They're having suicidal thoughts when they're using or withdrawing from opioids.
Denver Health has expanded its 24/7 methadone treatment program to respond to the crisis and has a new perspective on how to use medications more effectively to treat patients.
Reversal agents that we use, like Narcan, have to be given in higher doses when patients are using fentanyl. And then we've also tried new strategies. So we're using not only Suboxone, but also methadone to get people into treatment.
A poll released this week by KFF, a health policy research group, found only a quarter of opioid addicts surveyed received medication for treatment. That's why Denver Health started its no wrong door policy.
So we need to be thoughtful that we can provide addiction treatment in any setting, any outpatient clinic, any emergency department or urgent care when you're ready to get it. And I think that we've been so challenged in Colorado because we have siloed care.
Denver Health's Center for Addiction Medicine had 91,000 substance-related visits in 2022. Dr. Simpson says only about 20% of the patients he sees are homeless.
We also treat, young people who are, back home from college and they're struggling and they've relapsed and they need to get started, or their parents and family have brought them in. We see people who are professionals and working, and you might not even realize that they are struggling with an addiction.
For more context on what Denver Health is doing to combat overdoses, last month it became the first licensed youth detox facility in the state. It comes at a time when the hospital's emergency room treats 900 young people each year for substance-related issues. Fentanyl is the fastest growing issue among 14 to 23-year-olds.
Folks have just been struggling to cope for so long. And part of why they struggle to cope is there wasn't a lot out there to help them. Altering someone's trajectory is so important to make sure that they get on the path that they want, and that they feel like they are growing into who they want to be and how they want to do it.
The 21-bed facility includes classrooms, fresh air, courtyards, as well as social events. And of course, if you or a loved one needs help, you can always call the Denver Health Center for Addiction Medicine, also known as CAM. That number is on your screen, 303-436-5711.
Those numbers are
Scary.
staggering.
Yes.
But good to know there is treatment and help out there.
There's hope out there. Jessica, thank you for that.
Thanks, Jess. Meanwhile, Colorado Congressman Doug Lamborn talked with El Paso County school administrators and educators today about the dangers of fentanyl. He pushed the Protecting Kids from Fentanyl Act, a bill that aims to educate children about the drug and get teachers trained on the use of Narcan.
It's imperative that we educate students to not take these substances in the first place, but if something happens, there is a possible solution.
And if passed, Colorado would receive a $146 million grant to educate students and teachers.